program by, for, and about women today with Sandra Elkin.
Good evening. Tonight our second program on DES and DES daughters. With me this evening is Kay Weiss. Kay is a health researcher who has specialized in areas that concern women. For several years she has concentrated her efforts on analyzing the present vaginal cancer epidemic and the DES drug that caused it. She has been a research associate on several DES projects and a research associate at the National Health Center at Baylor Medical School. Welcome once again, Kay.
Thank you.
I think we'd better recap a few of the things that we said last week so that in case people did not see last week's program. For instance, let's talk about what DES daughters are. What is DES?
Well, DES is a synthetic estrogen which was prescribed to millions of pregnant women, mostly to prevent miscarriage, but also to prevent other complications of pregnancy, between 1940 and 1971. And DES daughters are the offspring of those pregnancies. It appears that the drug affected the fetal formation of the vaginal tissue, and a previously very rare kind of cancer, vaginal adenocarcinoma and cervical adenocarcinoma, have come to light in, so far, we think about 300 of those daughters. Now, many of them haven't reached puberty yet, or young adulthood, which is the time when the cancers do express themselves. Now, in addition to cancer, virtually all DES daughters, and there are between 1 and 3 million of them in the country, have adenosis, vaginal adenosis, or cervical erosion, and those are two names for the same thing, which is glandular tissue which was placed during fetal development on the vagina or the cervix where it does not ordinarily exist.
There's not as much cause for concern for sons, although you did say something about that last week.
Yes, there have been some preliminary follow-up studies on very small numbers of DES sons, and the indication is that we might expect seeing some abnormalities in them too. About 20 or 25% of them might, on the basis of these studies, have urogenital tract problems or testicular problems, and possibly even lowered sperm count and some degree of sterility.
We talked a little bit last week also about testing. And one of the points that you said that you wanted to make last week that we didn't get to make was whether or not all DES daughters should be tested.
Yes, I pointed out that there are special tests required, and that virtually all women who are under the age of 35 who suspect that they may have been exposed in utero to DES or other estrogens should try to get those tests. But I failed to point out that young girls who are under the age of puberty, who are younger than puberty, or say under age 14, should not attempt to get those tests, because the cancer is something that expresses itself after the age of puberty, and the tests are fairly uncomfortable for girls who are that young.
What is a colposcope?
Well, a colposcope is sort of a light mounted on a microscope. It's a special kind of instrument that can see through several layers of tissue. It is an alternative to the business of taking multiple biopsies from different areas, from different suspicious areas in the vagina and from the cervix. The kinds of tests that should be given to these daughters are not routinely offered in GYN exams. They're the iodine stain test is appropriate for adenosis, or the colposcope. For cancer, you need to take a special kind of pap smear from all areas of the vagina and the cervix, which isn't usually done. And sometimes a biopsy needs to be done after the staining procedure of those areas that don't stain. Those are the areas of glandular tissue.
Are these tests expensive?
Yes, unfortunately. DES daughters who pursue these tests, particularly the colposcopic tests, are paying about $50 every 6 months to get them for the rest of their lives. And if you figure that out, that comes out to an annual bill of about $200 million each year, and this cost is being absorbed by the victims of this drug itself, the DES daughters.
I've heard that there are some lawsuits. What is happening with those?
Yes, there are lawsuits being filed in several areas of the country against any number of the 200 firms that manufacture DES. Unfortunately, it's difficult to bring class action suits because the U.S. Supreme Court made a ruling on class actions that you have to notify all possible participants in a class action, which is all DES daughters, and there may be some 3 million of them. The problem with private suits is that few DES daughters can afford to bring them, and few DES daughters can identify the actual manufacturer of the DES drug that they took, because there were 200 manufacturers. So the lawsuits have not been very successful.
What made this happen? And I don't mean political or social, but I mean, what happened biologically, physiologically, to make this happen?
Well, fetal development is dependent on a balanced uterine hormonal milieu. And when that is tampered with, we can expect just about anything to happen. And these women who took synthetic estrogens during a time when the fetal vagina was forming caused deformations of the vagina and the vaginal tissue to result.
What are some of the common uses of DES and estrogen, uses that maybe wouldn't be obvious to the average viewer?
Well, DES is just one type of estrogen. It's one type of synthetic estrogen. There are many synthetic and natural estrogens available on the market, and DES was the most widely used until recently because it was the cheapest and it was the only one that was orally active until recently. But there are many
What does
kinds.
that mean, orally active?
That means it doesn't have to be given by injection. But that is why it was mostly DES that was given for anti-miscarriage drug purposes in pregnancy. But indeed, many kinds of estrogens are given for many purposes. DES, for instance, is given to suppress lactation. It's given to dry up breast milk after childbirth. Some 40 million American women have received it for that purpose. Probably.
I'm almost afraid to ask this because last week when you talked about DES to prevent miscarriages, you said it had been proven that it wasn't effective. Is it effective for use against drying up milk?
No, it's not. The medical literature indicates that it is not very effective for drying up breast milk after childbirth. The problem is that most women don't even know they're being given DES. It's often given as an injection on the delivery table if the woman has indicated to her obstetrician sometime during prenatal care that she didn't plan to nurse.
Well, what would happen if a woman didn't have the DES?
Well, if she didn't plan to nurse, then her breast milk would dry up naturally without the aid of the drug.
Would there be an increase in infections or something like that?
Perhaps a small percentage of women would experience painful breast engorgement, but DES is pretty much given routinely across the board to dry up breast milk after pregnancy. And it carries with it a high incidence of blood clotting, thromboembolism, when it is used irresponsibly in that way. DES is also used as estrogen replacement for postmenopausal women, and perhaps we can talk about that after I talk about some of the other uses. Synthetic estrogens are used for treatment of acne, thinning hair, excessive facial hair.
For tall people too, or something like that?
Yes, it's used to suppress height in growing girls who are predicted to be getting to be too tall. It's used to treat any number of gynecological symptoms, menstrual irregularity, hormone imbalance, so-called hormone imbalance, what have you. And of course, estrogen is used as an oral contraceptive.
Let's talk about it, estrogen and DES for postmenopausal women. Now there's a drug that has replaced the DES that's a normal or a natural estrogen, right?
Right.
It's
DES
called,
was the most common kind of estrogen given for postmenopausal estrogen replacement, but there's recently been a switch to a so-called natural estrogen, and my feeling is that the reason the switch was made is because DES has such a bad reputation now as a cancer-causing drug.
Was there any evidence that a natural versus a synthetic hormone, I mean, is one better than the other?
No, there is no evidence whatsoever that a natural estrogen is going to cause less cancer or fewer adverse other side effects than DES. Some recent studies were published about the increase in the incidence of uterine cancer among women who take estrogens for postmenopausal estrogen replacement. And it appears that
well, there's a new way of treating that now. They're giving it cyclically. Is that valid, do you feel?
well, there's no evidence that using it cyclically, that is, giving it to the woman 3 weeks on and 1 week off to allow the uterine lining a chance to rest, is going to decrease the incidence of uterine cancer. There's no evidence whatsoever, because when it was used that way as a sequential oral contraceptive, it resulted in an increased incidence of uterine cancer, and the FDA banned the sequential oral contraceptive.
How many women are taking estrogen for postmenopausal symptoms?
Well, about 4 million, and a recent study which examined the reasons for its being prescribed indicated that about 30% of these women are prescribed estrogen for, quote, mental symptoms, or symptoms of
like
nervous
what? Like
disorders.
depression or something?
Yes, depression, nervous disorders, senility, or even there's a category of use called special conditions without sickness. Now, the FDA has said that estrogen is not effective in alleviation of mental symptoms or depression during menopause. In fact, for most of the battery of symptoms and problems that are associated with menopause, estrogen is not thought to be effective.
Well, are there symptoms that it is proven to be effective against?
Yes, it is effective for treatment of hot flashes and for prevention of osteoporosis, but the FDA recommends that it be used over short term only for treatment of hot flashes, and this recent survey indicated that most women who take postmenopausal estrogen replacement are on it for 10 years. And by the way, if they're on it for 10 years, then that uterine cancer incidence is not multiplied by 8 times, it's multiplied by 14 times.
It seems, it seems very upsetting, to sit here and hear that it's being used for all these things that it hasn't been proven effective for.
Right, and especially when you consider that cancer is not the major or the only adverse side effect of estrogen use. When a woman takes estrogen, for instance, the oral contraceptive, she is disturbing 50 metabolic systems. And this is why you find such a wide range of adverse effects being reported in the medical literature. You have about 250 new articles being published every year in the medical literature testifying to the adverse effects of estrogen use among women. Cardiovascular effects, heart attack, congenital deformations in the fetus if the woman accidentally takes the oral contraceptive while she is pregnant, which often happens, and a whole battery of adverse metabolic and endocrine side effects.
Well, since 1971, we've known that there were problems with DES, but it's still on the market, right?
Yes, there are no laws prohibiting manufacturers from manufacturing DES for other uses, and no laws prohibiting physicians from prescribing it for unapproved uses.
But are most physicians not prescribing it now?
Most physicians are not prescribing it in pregnancy, specifically for anti-miscarriage use, because they have the evidence of the awful vaginal cancer epidemic since 1971. But a recent investigation by the National Disease and Therapeutic Index indicates that indeed, in 1974, about 500,000 prescriptions were written for estrogen or progesterone hormones to pregnant women. And this is only 10% fewer than were written in 1971, before the FDA sent out letters to each physician in the country asking them not to prescribe hormones in pregnancy.
Well, are people doing anything more than that about it? I mean, has the FDA been given more clout? I mean, what can the FDA do as far as a physician is concerned? I mean, what clout do they have exactly?
The FDA can only make recommendations to physicians. They can't regulate the practice of medicine. They can't ban a drug. DES...
but they can approve a drug.
They can approve a drug for a manufacturer. And as in the case with the morning after pill, well, let me say this, DES is not banned for use in pregnancy. It's not against the law for a physician to prescribe it in pregnancy.
Or what protection does a woman have then?
Well, I think to begin to question her physician and not to put blind faith and trust in her physician.
Last week, just as the program ended, You indicated that you thought that, not enough was being done to prevent another epidemic of this kind, and you expressed some concern about the morning after pill. Let's talk about that for a few minutes. What exactly is it?
Well, the morning after pill is DES or another kind of estrogen. When it's DES, it's taken in 50 milligram dosage each day for 5 days. That's the morning after pill. And this is a massive dose of estrogen. This is as much estrogen as 400 oral contraceptives would contain. Now, unfortunately, the FDA has approved and made available morning after pills to the population for emergency use only, such as after rape and incest. But in fact, that's not the way they're being prescribed. They're being prescribed quite routinely, sometimes repeatedly to the same women, and not just for emergency use only. The problem is, the bad part about it is that the morning after pill, as was the case with the old anti-miscarriage use of DES, is not even that effective. It has about a 10% failure rate, and that's very significant when you consider that most women who take it don't need it, because the chances of pregnancy after one unprotected intercourse are only between 2 and 10%. So most women who take the morning after pill, about 90% of them are taking it out of fear of pregnancy rather than out of actual pregnancy. It would be much safer for those women to wait and see if they turn up with a positive pregnancy test and then to obtain a therapeutic abortion. Now, the morning after pill carries with it a whole host of adverse side effects, such as thromboembolism. And it's a very bad situation because it can also probably exacerbate or increase existing latent cancer that the woman may have. For instance, breast cancer can exist for about 6 years before it can be detected. The National Cancer Institute indicates that probably about 225,000 American women have latent, incipient, undiagnosed breast cancer. You have 200,000 new cases of cancer of the estrogen-dependent organs each year being diagnosed, the cervix, uterus, and breast. And if a woman has these latent cancers in her body and she takes the morning after pill or any estrogen preparation, including the oral contraceptive, then she's exposing herself to the risk of causing them to become exacerbated and to grow rapidly.
Where are people getting these pills? I mean, are they getting them from private physicians, clinics, what?
Well, family planning clinics and university student health services are widely prescribing the morning after pill contraceptive. In fact, some of them have funding from federal agencies to test estrogens on women as oral contraceptives. Unfortunately, this puts the DES daughter generation at particular risk, because these are the women who have adenosis. Virtually 100% of DES daughters, many of whom are college age, have adenosis, and many of them could have latent vaginal adenocarcinoma. It's very difficult to diagnose. It has no symptoms. Their physician may not know that they have it, and if they take the morning after pill, then it could really exacerbate their condition.
Is any of this on the package insert?
Not very clearly, no. And another danger that isn't mentioned on the insert is that if a woman comes to take the morning after pill and she is already pregnant from a previous intercourse of several days ago or several weeks ago, and you know the pregnancy test won't tell you until you're 5 weeks along, and she takes the morning after pill, then she's going to expose an embryo to the risk of congenital limb and heart deformations and possibly even vaginal cancer.
It's really interesting because on one hand, DES was used to prevent spontaneous miscarriage, and now we seem to be using it to abort.
Right. Back in the 40s, when DES was being developed as an anti-miscarriage drug, we were under pressure for population growth. We wanted population growth, and this normal physiological function, spontaneous miscarriage, which happens in 1 in 5 pregnancies, was seen as a pathological condition, and every pregnancy needed to be saved. Now we're using DES for the exact opposite effect, as an abortifacient, as a morning after pill abortifacient, because we're trying to decrease the population. So it seems that the economic interests of the drug companies, because after all they do make millions of dollars a year on the manufacture of estrogens, and the population control interests are taking precedence over concern for women. With the sale of the oral contraceptive, the drug companies make about $120 million annually. With estrogen replacement after menopause, they make about $145 million annually. I don't know how much money was made on the use of the anti-miscarriage drug.
It seems as if almost across the board that the use of estrogen, you know, interrupts some normal natural function that is not necessarily a disease.
Well, this is often the way estrogens are used. For instance, to dry up breast milk, a normal physiological function is being chemically manipulated. Certainly that's what the anti-miscarriage drug was doing. That's what the use of estrogens to treat menstrual irregularity among women whose menstrual periods don't conform to a 28-day norm, which it says in the textbook that they should. It turns out that most women don't, research shows, but indeed many women are still given this drug to cause them...
I also know that many women want to take estrogen and want to relieve the symptoms of menopause or irregular menstruation, and that you know, physicians have lots of pressure on them from these women who feel that they cannot live with the symptoms.
Well, women have been told by their physicians for decades that estrogens are harmless. We've been told for decades, for instance, that if you continue to take an oral contraceptive during early pregnancy, nothing bad is going to happen to the fetus. Now it's shown to be untrue. It seems to me that physicians are a little too eager to manipulate nature, that we ought to go along with nature for a while and not try to control it, but cooperate with it.
But to go back to the morning after pill, can there be informed consent under those circumstances? I mean, truly informed consent?
Well, particularly with its use for rape victims in hospital emergency rooms, these women are under a great deal of stress, and it's kind of a sham to talk about informed consent when a woman comes in shock after having been beaten and raped, and then she's supposed to read 2 pages of literature about the adverse effects of the morning after pill and make a rational decision about whether to take that or to wait and opt for a possible menstrual extraction later. So, no, I don't think that there is really any informed consent under that circumstance. And when a woman is being assured by her physician that menopausal estrogen replacement or any of the other uses of estrogen are safe, then that's not informed consent either.
Well, you know, it's hard not to say whose fault is all of this. You know, I mean, it's really hard not to say that. We know it's not the FDA because they have no teeth. I mean, there's no legislation really mandating them. The private physician is getting pressure from patients. You know, is there a certain burden on women to educate themselves?
Well, yes, I think there is, and also to not put trust and blind faith in their physician and not put the responsibility for controlling the discomforts of pregnancy, menstruation, and menopause onto a physician. There ought to be more natural ways developed to deal with the discomforts.
What are some of the factors that you think, you know, social factors, political factors, whatever, that led to this epidemic?
I think that the education of medical students has a great deal to do with it. If you look at the OB/GYN medical textbooks and read them and how they portray women as basically childlike, unthinking, unintelligent, animal-like creatures, especially when they're going through pregnancy, as becoming alarmed and hysterical over a little bit of spotting during pregnancy, which is quite a normal thing, and then they're prescribed DES to prevent that from happening. That type of thing. I think you'll find that medical students essentially are still being educated to think of themselves as authoritative, infallible, and godlike. And this is, I think, one of the major contributing factors to the vaginal cancer epidemic.
Let's go back for a minute to one of the things that we talked about last week. And I would like you, we have about 2 minutes left, and I would like you to run down the first, second, third, etc. things that a woman should do if she suspects she took DES during pregnancy or at another time, and that it may be affecting one of her children.
Well, if it's a daughter involved, she should ask her mother whether she had had a history of miscarriage, toxemia, diabetes, or any complication of pregnancy. and if possible, gain access to the mother's obstetrical records by writing the medical records department of the hospital where she was born. Unfortunately, as I mentioned, some of these hospitals will not send the records without legal intervention, which is unfortunate. The woman should go and have an iodine stain test and a pap smear taken from all parts of the genital tract, and if possible, a colposcopic examination. She shouldn't get too alarmed about adenosis. Adenosis is benign, essentially.
And there is no evidence that adenosis leads to
no
adenocarcinoma?
No, there is no evidence whatsoever. Adenosis, in fact, there is some evidence that it may heal with age. After a woman passes through her 20s, that adenosis may regress. So there is no evidence that adenosis is precancerous.
Do you think the situation is going to get worse before it gets better? Do you think we're going to have more and more DES daughters?
Well, estrogens are certainly still widely used. You have about 90 million prescriptions a year being written for estrogens for a female adult population of 60 million. So, and given the fact that there's probably not too much difference between DES and the other kinds of estrogens in terms of cancer-causing potential, then indeed I think that there is cause to be concerned that another similar kind of epidemic will come to light in the future.
Is there anything that one individual person can do about it?
Well, question your doctor. Take a second thought before you manipulate a natural process like pregnancy.
Kay, thank you for coming back.
Okay.
We have an address where you can write for further information. Good night.
This program was produced by WNED-TV, which is solely responsible for its content. Major funding was provided by public television stations. Additional support was provided by unrestricted general program grants from the Corporation for Public Broadcasting and the Ford Foundation.